Okay, now my next question is pain and dysfunction. Sometimes pain doesn't always indicate where exactly the problem is.
Yes.
So how do you distinguish between the symptomatic area and the true dysfunction? Is a
Oh.
very important thing for the students. They sometimes get confused.
Yes. Okay. Um, so you talk about pain and you talk about dysfunction.
Yeah.
So the assumption here is if there's a dysfunction, the end result is pain, right? So if you want me to answer, I think it goes for the dysfunction and the pain will go. It's
Yes.
very logical, but it's not so simple.
Yeah.
Yeah.
Because patient want first to get rid of their pain first.
Yes, correct. So, but your question is, which one will I go first?
So pain doesn't always indicate the primary problem, primary mechanism.
Yes, correct.
Okay, so how do you distinguish between the symptomatic area and the true dysfunction?
So first of all, the underlying importance of all that is, first of all, you have to know your anatomy, your physiology very well. There's no question about that. You got to know this. Number two, number three, you have to reflect and back up with a lot of your clinical experiences that you have over the years, because that all comes together when you're treating the patient, right? Because some of the treatment when I do, even though if I have not palpated the dysfunction, the criteria for where the dysfunction is very clear to me. Right? If somebody, let's talk about clinically, if somebody have a tear in the supraspinatus, it doesn't take too long to identify where is it, right? So even before I do anything, they tells me certain thing, I'm very clear even before I touch, because it's very obvious, you see? So that comes from your clinical experience, right? So the moment you know that, you know you're in control, because then the pain will settle because you know where to go and how to treat. Yes, but it's not always like that. Yes, correct. So I think first of all is if patient comes in, they say they have pain, make sure you that you acknowledge that okay, yeah, I can see that you have pain. I say, you have this pain, and I can share with you that this pain can arise from different areas, but let me do a global assessment and let me see how is it coming from. I understand that you have this history, but let me work up my assessment and see how it comes to that. So sometimes that's where you can buy some time and then do some assessment where you can identify the dysfunction. Yes, or you can assess them based on that pain and then move into the dysfunction. So in a sense, you are tricking the patient. You know that okay, I can see where the pain is, but it could be somewhere else. Let me do my job and let me help you. So that's where we come in. There, where we step into that territory. But you got to remember that when you're doing that, do not forget to reach back out to why he came back in the first. Why did he come to see you in the very first place? So you can kind of complete that cycle. I think the patient has more trust in you, and so the best part of that is that you have the liberty to go for where the dysfunction is.
Yeah, that's
correct. Does that make sense?
Makes sense.
Yes.